We have an amazing program ahead of us today. With us here, not only on this stage, but throughout the room, are hundreds of extraordinarily accomplished people from all over the healthcare community. Your physicians and policymakers, activists, innovators, scientists, and CEOs. You are people with the power and the platforms to create lasting change. You know, there's a reason why health is central to what we do at Time. We're living through epic global events with a news cycle at warp speed. Yet there is no topic more personal or more important to our audiences than their health and the health of their families. There's never been more health information available to patients, yet at the same time so much confusion about what information can be trusted. There's also never been more innovation in both wellness and treatment, and yet unequal access remains one of the blights of our age. What, for example, is the biggest single factor in determining how long each of us will live? It may be your zip code, as my colleagues at Time reported earlier this year. Here in New York, according to NYU data, average lifespans are almost 20 years longer for people living on the Upper East Side than their neighbors in nearby East Harlem. Those challenges and opportunities are what bring us together today. They are also what our growing Time 100 community is all about, convening the world's most influential people across every field toward collaboration, access, and progress. In that spirit of collaboration, we're going to do something today that we've never done before, which is invite all of you to help us produce next week's issue of Time, a special edition focused on what we as a society need to do to seize this incredible moment of possibility in healthcare. To get the thinking going, our creative director, D.W. Pine, who is, I think, wave, D.W. There you are, over there. D.W. has mocked up a few covers for us. This is what we do every week at Time, although usually with a smaller group. We're going to talk about today about medical advances like CRISPR gene editing and unlocking the microbiome with, do we have the covers? Yeah, good. With some of the great innovators of our time. Dr. Carl June, the immunologist, is here, geneticist Dr. Eric Lander, surgeon Dr. Laura Esserman, all of them past Time 100 honorees. We'll talk about AI and machine learning and how they're beginning to transform cancer treatment and elder care. This is the cover on that subject. And we have an extraordinary group of policy leaders to discuss the public health challenges we face, from the dire consequences of climate change for public health to vast inequalities in access to care. We are honored to have Vice President Al Gore with us today. He'll be on stage momentarily. The 42nd President of the United States, Bill Clinton, will be joining us this afternoon. And from the Trump administration, we have the three most powerful officials in the federal healthcare system with us. Secretary of Health and Human Services, Alex Azar, Director of the Center for Medicare and Medicaid Services, Seema Verma, and the Director of the NIH for the past decade, Dr. Francis Collins. He oversees a $39 billion budget that funds some of the world's great research institutions. Throughout the day, I hope each of us get a chance to think about what we can all contribute toward a better, healthier world. And I encourage you to come find me or our summit co-chairs, Alice Park and Dr. David Agus, you'll meet them shortly, to share your own ideas about these opportunities and challenges and your own thoughts about what we at Time should highlight in next week's issue for our readers around the world. You can also email us anytime today or in the coming days at health@time.com.